Occlusal films can also be done for the mandible, as in the maxilla, and the idea, as we pointed out earlier, is that we need to use these films if we are using the if we need to cover larger areas that cannot be otherwise covered by the smaller size film. If again you're using the analog occlusal film, which is known as the size 4 film, 5 by 7 centimeters, this is the perfect one for exposing the whole mandible. Here, this is the exposure side of the film, and this is the back side of the film, this is general for all films. What you do is that you flip your film so that it points down, okay? And then you introduce your film inside the oral cavity. Okay, you introduce your film inside the oral cavity, see oblique, inside the oral cavity, rotate, and push it all the way back. So that you guarantee the largest coverage of the mandible or the maxilla. You better look inside the oral cavity to see how much the film can be extended. One good sign of knowing when to stop is that when the patient starts to blink, it means that he's being irritated from that film. So at this time, this is the time to stop introducing the film inside the oral cavity. Then you ask your patient to bite, okay? Now, as in the maxillary, we have two exposures. Here, if you want the anterior part of the mandible, the symphysis and the parasymphysial areas, then you are going to direct the beam minus 45 degrees up, minus 45. So this is 0 angle, okay? If this is 0 angle, minus, you know, it's upwards, okay? So it's directed upwards, 10, minus 20, minus 30, minus 40, minus 45, and then you will direct it on the chin of the patient, okay? See? You will direct it on the chin of the patient, which is very much similar to the lower incisors periapical exposure, but of course the fin position is different. This is the fin, and these are the teeth. So you direct it perpendicular on the bisector of the angle between those two. Okay, so this will show the lower anterior or the symphysis area of the mandible. Now, if you need the whole mandibular floor of the mouth or the mandibular area, then you are going to use the topographic or the 90-degree occlusal film. In this technique, what you will do, you will ask your patient to tilt the head backwards as much as the patient can tolerate, and then you are going to direct the beam in a way so that it will be perpendicular on the film. Film, X-ray. So the X-ray is going to be perpendicular on the film, and make sure that the beam is directed along with the mid-sagittal plane, so that you will guarantee that you will have equal coverage of both sides. Okay, if you direct it to either side, this side or this side, let me show it to you from the other view. See, it goes along with the mid-sagittal plane. If you direct it either side, you will not have complete coverage of the area. Okay, so you better direct it with the midline or the mid-sagittal plane of the patient.